But I want to ask you something personally. In this field of metabolic psychiatry and metabolic interventions, are there specific questions or specific phenomenon that you are personally struggling with right now in this field? Things that you didn't you don't understand yet. Don't have the model to explain it. What are your own questions in this field right now? What are the things that still you don't have full answer in
Yeah,
it?
well, yeah, my focus is mostly on clinical practice of using ketogenic diets as a treatment for mental illness. And so there are some questions that we don't have for the use of ketogenic diets with that population at this time. So things I wonder about are much more clinically motivated. So one of those questions is that do people who use a ketogenic diet as a treatment for mental illness, do they have to stay on the diet forever? Because often that's a big concern to people, and they
Many
often won't
many
even,
people ask me that.
yeah, they won't even try it because they think that that might be the answer. And so I'm very curious about that being studied in this population because what we know from the epilepsy world is that when it's used for seizure control, that people use it between 1 to 5 years. And
Mm.
after that point, their dietitian or their nutritionist and their doctor have a conversation and see about try titrating up their carbohydrate intake to see if they get seizures or symptoms. And so it's a very careful consideration. But out of there, about 50% no longer need to do a ketogenic diet, which would suggest that the brain has healed whatever metabolic dysfunction that caused the seizures in the first place has been resolved because they go off and they have pizza and hamburgers and they eat a normal standard American diet. There is a certain
Mhm.
percentage of individuals, though, that do have to stay on some form of low carbohydrate diet, but often it is not as low of carbs. So we generally use 20 net grams of carbohydrates in diet constructions in general. Bigger people get a little bit more, it's personalized. But sometimes people can move up to 40 to 60, or some people can stay symptom free, on as much as 100 net. But, that isn't in the first 6 months or the first 3 months of them trying to heal their brain with a ketogenic diet. So I'm curious to see what that looks like. I'm curious about all kinds of things clinically, right? So I'm also curious about the effects of medications on ketogenic diets. Some of the
Mhm.
medications that the individuals uh, come with, there's like lots of them, 3, 5, 7 psychiatric medications that work by affecting metabolism. And so, what are the effects of adding those to a ketogenic diet? When is the appropriate way and time to titrate? Um, and the safer ways to do that. So here in the States, we really have to be very careful. So for your listeners who are thinking about using a ketogenic diet as a treatment, I want them to understand that there's two parts to it. The first part is mastering the ketogenic diet. And maybe you need to go see a dietitian to do that, and maybe you don't. Lots of people get treatment effects without someone like me helping them. And then the other part is self educating yourself about hyperbolic tapering because many
Mhm.
prescribers think that they're very, very good at tapering when in fact they are not. There are deprescribing guidelines that have been accepted in other parts of the world for hyperbolic tapering as best practice and not in others. And if a prescriber adjusts someone's medication down too aggressively for them, they can get a recurrence of symptoms that the prescriber then says, "Oh, look, see, you need medication," when really they've been injured. It's a rebound psychosis,
Yeah.
or they're having a
Mhm.
withdrawal syndrome. So there's
Protracted
really these
withdrawal.
two parts. Yeah. So I have questions. I've lots of questions about that because I really find that, we're pretty good at fine tuning their ketogenic diet and getting them into good levels of ketosis, therapeutic levels. The sticky part comes when they need to have their medication adjusted down. And most people, the majority, do need their medication to be adjusted down. Because the amounts that they were on will suddenly become too high for them and they will get side effects. It's called potentiation. And so it's
Mm-hmm.
an important piece of the psychiatric recovery process for individuals using ketogenic diets in this way.